Welcome back to another episode of the Lost Book of Herbal Remedies. I'm Alex.
And I'm Emma. Today we're tackling a topic that has become a pressing global concern, Mpox. Recently, the World Health Organization declared Mpox a public health emergency of international concern, and for good reason.
That's right, Emma. On August 14th, 2024, the WHO made this declaration for the second time in just over 2 years. The situation has escalated, particularly in Central Africa, where a new variant of the virus has emerged with enhanced transmissibility and virulence. To make matters worse, this variant has now been detected in Sweden, marking its first appearance outside Africa.
The spread of Mpox beyond its endemic regions is alarming. It's a stark reminder of how interconnected our global health systems are and how a threat in one part of the world can quickly become a global crisis.
And it's not just about the virus itself. This outbreak has highlighted significant concerns around global health equity, vaccine access, and the need for authentic solidarity among nations. We've seen in past health emergencies how disparities in healthcare resources can severely hinder effective responses.
Absolutely, Alex. The Mpox outbreak underscores the urgent need for a coordinated international effort. The emergence of the virus in regions previously considered safe shows that no country is immune. It's a call to action for all nations to work together to mitigate the spread of this disease.
So let's dive into how Mpox affects the body. The monkeypox virus, or MPXV, is a double-stranded DNA virus that primarily infects humans, non-human primates, and rodents. The infection usually begins through mucosal tissues and then spreads to regional lymph nodes. This entry point is crucial because it allows the virus to bypass some of the host's early immune defenses.
Once inside, MPXV uses sophisticated strategies to evade the immune system, which is a key factor in its success as a pathogen. It can suppress interferon production and inhibit the activation of immune cells. For instance, MPXV can block the C-gas sting pathway, which is critical for sensing viral DNA and activating antiviral responses.
Understanding these virus-host interactions is essential for developing effective antiviral strategies and vaccines, especially as the virus continues to adapt and spread to new populations.
Now let's talk about the current situation on the ground. The Mpox outbreak has reached critical levels, particularly in the Democratic Republic of Congo. Over 14,000 cases and 524 deaths have been recorded this year alone, which is more than in previous years.
The Africa Centers for Disease Control and Prevention has declared the outbreak a public health emergency of continental security. The new variant, Clade 1b, is better adapted to human transmission, raising fears of a potential epidemic that could spread far beyond Africa.
The detection of a case in Sweden suggests that there may be many undetected cases across Europe. This highlights the urgent need for enhanced surveillance and preventive measures. Countries like China have already started implementing screening measures for travelers and goods entering their borders.
While these measures are proactive, they also raise concerns about stigmatization and potential discriminatory practices against countries experiencing outbreaks. The balance between public health measures and societal perceptions is critical in managing the response to Mpox.
This brings us to the role of global solidarity. The Mpox crisis underscores the importance of addressing inequities in health systems worldwide. Vaccine access is a significant concern, especially in African countries where the need far exceeds the current supply.
The Africa CDC estimates that approximately 10 million vaccine doses are needed to control the outbreak, yet only about 280,000 doses are available. This pattern of slow response from high-income nations has historically led to vaccine hoarding and inequitable access, jeopardizing global health security.
The WHO's recent declaration is a clarion call for countries to work collaboratively. Without genuine commitment to equity and support for affected regions, we risk repeating the mistakes of past health crises.
Let's shift gears and talk about the strategies and solutions for combating Mpox. The virus primarily spreads through close contact, respiratory droplets, and sexual activities. Clinically, Mpox resembles smallpox but is generally milder. However, it can still cause significant discomfort with symptoms like fever, muscle aches, sore throat, and fluid-filled skin lesions.
Mpox has two distinct clades. Clade 1 is associated with more severe disease and higher mortality, while Clade 2 is generally linked to milder disease. Vulnerable populations, including children and immunocompromised individuals, are at higher risk of severe disease, with case fatality rates ranging from 1% to 10%.
Vaccination remains the cornerstone of prevention. Vaccines developed for smallpox, like Jynneos and ACAM 2000, have shown effectiveness against MPXV. Jynneos, a non-replicating vaccine, is particularly suitable for individuals with compromised immune systems, while ACAM 2000, a live vaccine, is contraindicated for certain groups.
In addition to vaccination, antiviral treatments like tecovirimat and brincidofovir have been authorized for use against Mpox, although their effectiveness specifically for Mpox is still being studied.
As the outbreak evolves, it's clear that we need targeted interventions tailored to the unique challenges of Mpox. This includes a comprehensive public health approach, combining vaccination, therapeutics, and robust surveillance measures.
Vaccine acceptance is also crucial. A study in Ghana revealed that only 32% of participants were willing to accept the Mpox vaccine. This highlights the importance of building trust in vaccines and public health systems through targeted educational campaigns.
Engaging community leaders and individuals with a positive vaccination history in outreach efforts can also bolster public confidence in the Mpox vaccine. Increasing vaccine uptake is essential for controlling the outbreak.
Addressing the Mpox outbreak requires not just vaccination, but also robust public health measures like surveillance, contact tracing, and public awareness campaigns. The WHO has called for improved surveillance systems to detect and respond to Mpox cases promptly.
It's also essential to consider the unique challenges faced by vulnerable populations. Tailoring public health interventions to these specific needs is crucial in mitigating the impact of Mpox.
Investment in healthcare infrastructure, particularly in regions with limited resources, is necessary to ensure that health systems can effectively respond to outbreaks and provide adequate care for those infected.
And now, let's discuss the role of herbal remedies. Given the complex nature of MPXV infection, creating an advanced herbal formula requires a multifaceted approach.
Targeting viral entry and replication is one aspect. Licorice, for example, contains glycyrrhizin, which has antiviral properties and may help block MPXV from entering cells. Green tea's EGCG also shows potential in inhibiting virus adsorption.
Supporting host immunity is another critical aspect. Echinacea is known for increasing white blood cell production, and astragalus can enhance interferon production, both of which are vital for an effective immune response against MPXV.
Counteracting immune evasion is key as well. Reishi mushroom has immunomodulatory effects, and curcumin from turmeric exhibits anti-inflammatory properties that can help counter the virus's strategies to evade detection.
Herbs like St. John's wort and olive leaf offer general antiviral support, potentially interfering with viral replication and protein production.
However, it's important to approach the use of herbal remedies with caution. They should not replace vaccines, but can offer supportive care when used responsibly and in consultation with healthcare providers.
In conclusion, the Mpox outbreak is a significant challenge to global health. The recent WHO declaration emphasizes the need for equitable access to vaccines and comprehensive public health measures.
As we navigate this crisis, the lessons learned from Mpox can inform future responses to infectious diseases, highlighting the necessity of preparedness, equity, and collaboration.
Thanks for joining us on the Lost Book of Herbal Remedies. We hope this episode has provided valuable insights into the Mpox crisis and the role of both conventional and herbal remedies.
And don't forget to tune in next time for more discussions on herbal remedies and natural health. Until then, stay safe and stay healthy.
See you next time.